Hey Zingers, it's Dan Leach, and I have some wonderful guests for you today. Dr. Kevin Chung, Chief Medical Officer of SeaStar, Dr. Stuart Goldstein of Cincinnati Children's Hospital, and Dave and his son Kurt, who was a patient of Dr. Goldstein's at Cincinnati Children's Hospital that had some incredible results. It is so great to be with all of you today. And Dr. Chung, let's talk about Qualimmune and how does it work to treat these patients and save their lives?
Yeah, so thanks, Dan. So Qualimmune is really designed to target the innate immune response. And so when patients get very sick, it becomes very dysregulated and cells really go haywire and really trigger something called the cytokine storm. The Qualimmune device is designed specifically to target the cytokine storm at the source of the storm. And it is associated with really good outcomes, especially in the pediatric population where mortality was cut by half from 50% to 25%.
I love that you can tell us about Kurt. I know he's one of the patients that you treated with the Qualimmune therapy at Cincinnati Children's Hospital and how that patient responded.
Yeah, so Kurt was, as all of these patients are, very, very ill, who had underlying chronic cardiac disease from a pediatric standpoint, not like you would think of adults with heart disease. And he developed acute kidney injury and respiratory failure and was getting prepared to be put on ECMO, extracorporeal membrane oxygenation, where that's even a more advanced, more invasive therapy to support somebody who's critically ill. Kurt needed CRT as part of his standard of care and clearly was inflamed, and we presumed had an infection. And I said, I think this device is really going to be helpful for him. Kurt just started to turn around within about 24 to 48 hours, did not require ECMO, left the ICU within probably 2 to 3 weeks and resumed his going back to high school and golfing. It was just quite dramatic. And he is just emblematic of when we see this work, which is far more often than not, patients turn around really, really quickly when you would have not expected them to.
What an absolutely beautiful story. I want to go meet Kurt on the golf course right now. It's just great to hear that. Now let's hear from a patient and his father and their real life experience. Dave, if I could have you also describe your experience. As Dr. Goldstein said, this was a new therapy, and here's your son very ill. How did you make the decision to allow the use of Qualimmune for your son?
Yeah, Dan, it was kind of like, I think it was like day 11 of Kurt being in the ICU, and things weren't looking too good. And my nephew, who's a doctor, he took my wife and I down to the lunchroom to eat dinner. And I said, hey, do you mind just walking upstairs? I said, every night we think everything's decided for the night, but there's always somebody there with another question or another decision to make. And sure enough, Dr. G was there. Thank God. And Dr. Goldstein, he basically asked if we would mind going on a trial therapy that he thinks it would really help with the inflammation. And I just turned it over to my nephew and let him listen to it all. And he said, yeah, I don't see any reason not to. I mean, at that point, we were definitely looking for some answer that, to help this turnaround, because it was looking pretty bleak a couple days before that, right? So the kidneys were shutting down, the heart, was doing the best, and that's what he went in for, was a heart surgery. And but unfortunately went into, an ARD situation, which acute respiratory distress syndrome. So he had no breathing ability. He was, had a trach, and it was just, every organ was shutting down until the ARDs got better. That nothing else could recover. Everything was shutting down. His kidneys were, starting to go. So they decided to put him on that morning on continuous renal machine, so that continuous kidney therapy that morning. So we just said, let's do it if you think it will help. So we went ahead and did it. So.
And obviously the outcome was very, very good. Both you and Kurt are here to talk about it today. Can you even describe the feelings you had when you saw that Kurt's condition was improving?
It was just amazing to see the recovery. I kind of forgot all about this Qualimmune, but we were asked to do a testimonial for the FDA approval, And I was like, you know what? I looked back to the diary. He was only on that thing for 6 days, and he got immensely better after he got put on that. So it was, was that the whole thing? I don't know. I'm glad we didn't have to find out what the other outcome was. So it was pretty unbelievable for my wife and I and the whole family, and just to be able to see him come out of it, and obviously in a very weakened state, but nonetheless he was out of it, right? So, and then he continued to improve every day, even after he was off that. It just, the improvement once he got through that was every day. So,
Kurt, first of all, it's wonderful to have you here. Congratulations on what looks like a full recovery from what could have been a pretty devastating condition. Any memories of your time in the ICU?
It was a little hazy on the memories for early on, but then, definitely remember a lot later on past Christmas Day. But I think I woke up. My first memory was just my parents standing there, and just didn't really have understanding what was going on. Obviously, I woke up and I had a lot more things on me than I initially thought I would have. I had an NG tube, and of course, one of the first things, one of the times I woke up, there was nobody in the room, and I had no idea what was going on. So the first things, of course, I do is I think I lost about 22 pounds or so when I finally gained consciousness, and I just couldn't move or press the nurse assistance button in the bed, or move anything. So I started feeling around. I was like, well, what's what's a monitor that I could try and first thing I do is pull out my NG tube, so just to get their attention. Of course, that didn't set off any alarms, but that was like one of my first memories waking up, was just trying to get somebody's attention.
And what about your recovery? What was your recovery like?
Recovery was not easy, but it was still a struggle, just because I lost all that muscle mass, and it was tricky. It wasn't easy. Just a lot of help along the way, family, friends. I was able to keep pushing myself, and I was able to start building that, getting my weight back, and start building that muscle back and my stamina, and just being able to do a lot on my own. And luckily by towards the end of February, early March, I was starting to be able to obviously play golf again, and being able to just walk around all day without having to go to bed at 6 o'clock. That was really the big recovery part. But yeah.
Thanks so much, David Kurt. Just so wonderful to be with you today.
I appreciate you having us and letting us tell, Kurt's story, because it really is a life-changing situation. It's a life changer.
And on a parting note, here is a clip of Kurt at his NCAA golf event just months after leaving the hospital. It's pretty clear that Kurt's drive to recover was partly inspired by his love of golf, and with a drive like that, he certainly looks like he's made a full recovery.